oxygen is do not hyperventilate. And again, it goes back to what we were just talking about, why it may be bad. If you hyperventilate, it adversely affects cardiac output and adversely affects cerebral perfusion because perfusion closed down. Again, it's determined by CO2, and if you've blown off all the CO2, cerebral vasculature closes down. The brain doesn't need more oxygen, says, all right, I don't need much. So, and then do not overventilate. That means, you know how you take it in that bag and you're pushing it as hard as you can? What you're doing is you're doing a couple of things. Number one is excess oxygen is bypassing the lungs and going into the stomach, increasing gastric distension, possibly leading to vomiting, and barotrauma in the small airways. How many of you remember something called a Robert Hall valve? Any of you have that? And we'll talk about, well, I'll talk about it now and we'll see it later. A Robert Hall valve is called a demand valve. Have any of you ever seen those? Where you put it on and you press the button and it shoots. Those are dangerous in children. They have been known to blow out the bottoms of the lungs.
Ooh, what's it called? Robert what?
It's called a Robert Hall valve or a demand valve. And you just press a button and it automatically, yes?
Just quickly going back to what you said before about the 100% oxygen.
Mm-hmm.
You're saying 50% is sufficient.
It should be sufficient to resuscitate.
Assume that you're going to be becoming nitrous oxide with it. Is that what the assumption is, that it's 50%?
No, we're talking about resuscitation. In resuscitation, the nitrous oxide is off.
Okay,
So
your 50%, if normally you shoot for 100% oxygen.
Mm-hmm.
So once you shut off that nitrous, it's 100% oxygen.
Right, which is what you're going to be using for your resuscitation.
So my question is, where are you getting the 50%?
There are some kits you can get which have 50% oxygen, 50% CO2. They have 50% oxygen, 50% nitrous. Nitrous, you know, like it's called nitrox.
Right.
And you can even use that for resuscitation.
So,
But the point is, anything above 21% will help in your resuscitation.
and assumingly, the nitrous should actually help because it causes the second gas effect. Because they're getting the oxygen.
You know, that's a very good question, and this isn't electron nitrous oxide, but the second gas effect is theoretical. It has not been proven. And so that purpose when we turn the nitrous off and we keep the kid in the chair on 100% O2, you don't really go through a transient hypoxia. It was all theoretical based on molecules and osmosis and moving across a membrane, but it doesn't occur in reality. And the reason we put the 100% oxygen on at the end of the procedure is to keep the kid sitting in the chair while I write my chart, really. That's the reason we put it on, but there's really no true benefit other than to keep the kid from falling, to put 100% oxygen and keep the mask on at the end of a procedure for 5 minutes. Remember that it's 5 minutes, but that transient hypoxemia does not occur. So, does anyone have any comments? Please feel free to jump in, because this is, you know, I'm not here to lecture, I'm here to talk and actually start a discussion. So, any comments on that? Good. So in other words, if you can't get your 100% oxygen, start your resuscitation anyway. We did one case, okay, another case in California where the dentist didn't have an oxygen tank, or the oxygen tank was out, and he said, well, I couldn't do resuscitation because I didn't have oxygen. It happens in the heat of the moment. Your mind doesn't think correctly. So
You're talking about prevention, and you passed over albuterol, which I think is pretty important when we have asthmatic kids.
we're going to talk about that. I'm going to go through about 10 emergencies,
Cool.
and albuterol will be one of them. Epi is the second drug of choice. Three major actions you all remember. It's a bronchodilator, a vasoconstrictor, and increases heart rate. And so depending on the dose, it's going to do one of these three things. In general, it can do all three of these things at the same time. So it's used for bronchospasm, it brings up the heart rate, and it causes vasoconstriction in peripheral arteries. So How many of you saw Mutant Ninja Turtles?
A little bit.
The new movie? They actually use epinephrine in the movie to bring the Mutant Ninja Turtles back to life. I was very impressed with that. For those of you that treat kids, you know you see every single movie for every kid. Am I correct? For the pediatric dentists here, my family won't go with me, so on Friday nights, I'll go to the movie theater and catch like the 10 o'clock show or 11 o'clock show, and it's usually me and 3 couples in the audience, and they're all looking at me. I'm sitting in the back watching kids' movies. Anyone see Planes? The new Planes movie? Search and Rescue?
Frozen.
Pardon me?
Frozen.
Yeah? And so you'll see what we have. Excuse me. My throat's going out today. You'll see what we have. We have most of these things available for you to use today. We'll run through the processes. We'll skip that. Now, where do you give injectable emergency drugs? I get this question all the time. I don't have an IV. I'm going to spend the time. I'm going to start an IV. What happens if you spend the time starting an IV? You lose your ability in some cases to give the drug, especially if the kid is hypoxic, hypovolemic, and hypercarbic. Where are those little blood vessels on that tiny little kid? So what's your next option? Is to give it in a large muscle mass as long as there is a heart rate, right? As long as you can get the drugs to circulate, you can give it in a large muscle mass. So what are some of them? Intraosseous is the PALS recommended. In the vascular beds. And what's the most familiar area for us to work? Inside the mouth. So you can give submucosal. You can go to the pterygoid plexus. You pull the cheek out. You go up beyond the distal of the second molar or the most distal molar. You go up, aspirate, and give your meds right there. You can do it sublingual, floor of the mouth. What's the only problem with this? Pardon me?
Tongue swelling.
Tongue swelling, or the floor of the mouth goes up, and you can block the airway. You can also give it in the tongue, but you better be careful. You can only give one drug, at least my opinion, is you can give one drug once in the tongue before it will swell. But you can use the tongue as a very large vascular bed with great uptake very quickly. The buttocks, you were talking about the calf over here, with the buttocks, or the thigh. Airway is vapor, but they only work as long as there is circulation. So when you do your emergencies, tell me where you're going to give the drug. Where are you going to give your emergency drug? I'm going to start an IV. How long are you going to waste in time starting an IV before you have to give a drug? So you and your team members will talk about that and figure out when you're going to give a drug IM versus when you're going to go ahead and give it IV. Yes?
With the pterygoid plexus injection, how up on the list is that as far as location?
That's probably second. The first is submucosal.
Is there a fear of, let's say, cavernous sinus thrombosis? Is that anything that is?
Not that I've ever read in an emergency situation, but I don't know. Perhaps you know that. Have you read anything about that?
I'm just thinking, anatomically speaking, what could happen?
But submucosal to me is always the first place where I give my drugs. So, or in a large muscle mass. So,
I was going to say, deltoid will work too.
get deltoid will work,
Lateral thigh.
that or thigh, as long as you have circulation. The pterygoid plexus, your biggest risk is hitting a blood vessel or hitting a nerve. But I don't, cavernous sinus thrombosis, I'm not really sure what the complication rate would be for that. But I will look that up. Thank God for Google. How many of you read the books The Circle? Dave Eggers' new book, which is kind of a takeoff on Google and what Google's done. Any of you from California? So you don't know what this whole thing about Google and Google buses coming to my neighborhood, picking up people and transporting thousands of people down to the Google headquarters in Mountain View?
No.
And I live in San Francisco, and that's a 45-mile drive, and they have these kids that line up, and they all stand on line with their cell phones. No one talks to anyone. They line up, they get on the bus stops all over San Francisco, and then drives them down. So they leave at 6 in the morning, and they get dropped off at 8 at night.
Wow.
They're
What
robotons.
are they going to Google for?
They work for Google. Google has...
Kids?
Huh?
You said-
Well, kids, I mean, 22-year-olds.
Okay.
Are kids to me.
Okay.
22, 23,
And there's a
24.
book called Circle.
Right, and the book is called The Circle. It's Dave
The
Egger's
Circle.
new book.
Okay.
And it's kind of a takeoff on this, but it's kind of it's a cross between Brave New World, Animal Farm, Fahrenheit 451, and Tales of the City. So it's kind of a very bizarre sort of book. But anyway, the IO needle, how many of you have ever used an IO needle in real life, other than in PALS? It works. If you have the little drill press that goes through, it really, really, really works. So, this was in real life on TV. I'm not sure the sound is going to be loud enough. This is from the TV program ER. He's drunk, or he was drunk. I can't remember what it was. Drugs or drunk. Pay attention because he tells you exactly where to do it. So 1 finger breadth medial to the prominence is where you're supposed to do it. And the kid is saved. And it's a miracle. Just a miracle. All right, oxygen. If you have colored masks, that's a mask for you to breathe into. Again, expired air is what percentage of oxygen? 16%. So that will work. It's not as good as room air, but expired air is 16%. You need a bag valve mask, which is going to be the key to what you're going to work with today, and all these other things. Let's go through these. Your mask has to be clear. If you have those colored masks without an inflatable ridge, they're not good. You've got to be able to see the lips. Why do you think they're clear? You can see the air, you can see condensation, but the real reason is to make sure you're not pinching the nose and the lips.
Color.
Pardon me?
Color.
And the color is
Flanges.
one of the, right, you can check to see if there's some blueness but again, under all our lights, it's really hard to see what's going on, but it's mainly to make sure you're not pinching the nostrils or pinching the lips shut. What's the correct size nasal mask or facial mask to use? One that fits from above the chin to the bridge of the nose. That's the correct size. And here it's hooked up to an ambu bag. Some of you may have this system where you don't have a reservoir bag. And what's the purpose of a reservoir bag? Very simply, a reservoir bag, as the oxygen comes in, as you press in, oxygen needs to go into the patient, but it's never enough. And so it draws out of the reservoir bag. So even if this is filling at 10 liters per minute, you're pumping in at 20 liters per minute, you need extra oxygen. It comes from the reservoir bag. And this is also another form of reservoir. Because oxygen is heavier than air, it will sit in this reservoir. You open it up, and it's a great reservoir. So if your ambu bag is missing, if your reservoir bag is missing, you can always hook a tube up in the back, and that acts as a reservoir. So again, 16% O2, through expired air, 21% bag valve mask just in a room, and 100